Zero harm means to me that I properly identify my patients' needs early on, and I'm proactively advocating for my patients to keep them safe in every way possible.
Zero harm means making patient safety the #1 priority. As a nurse, you always want positive outcomes for your patient, and you do everything in your power to achieve that.
I wanted to talk to you about DVT prevention. Here in the ortho unit, being patients after surgery, we like to take that very seriously. We prevent DVTs with SEDs, other prophylactics such as aspirin, heparin, Lovenox. We want to make sure our patients are very happy with our care. We want to make sure that they're leaving here injury-free. We take our zero harm policy very serious here at Glendale Adventist.
Zero harm to me means frequently checking patients' labs, if it's critical, communicating with the doctor, safe administration of medication, and anticipating the needs of patients as far as if there's pain and toileting the patient so that they are safe and rehabilitated by the time they're ready to go home.
It means doing everything we can to make sure the patient is safe, to prevent falls, to prevent pressure injuries, to maintain skin integrity, to prevent infection. Make sure that we are meeting all their emotional needs as well, so that they have the very best in their stay.
Zero harm for me means to do thorough patient assessments, hourly rounding, and anticipating all patient needs.
For me, it means to prevent any patient falls or any hospital-acquired infections.
For me, it means preventing medication errors and questioning any orders that might be unusual.
Yay!
Here in Adventist Health Glendale, for medical unit, the safety of our patient is a #1 priority. When a patient gets admitted to unit, we identify our patients that are fall risk. We use the wristband. Also, in every patient's room, we put the fall precaution sign. It lets the staff know that the patient inside the room is a fall risk. So whenever a patient gets out of bed, we use the non-skid socks that come on different sizes to accommodate every single patient. We ensure that the call light is within reach. Education is always the most important thing for the patient.
Make sure that we have the bed alarm on while patient is in the bed by pressing iBed and alarm on, and educate the patient when they try to get out of the bed to call the nurse for help.
Zero falls, zero harm, zero injuries to all the patients.